When we first started thinking about developing Hoag Orthopedic Institute, we were asked early on, what's our vision? What's our goal? What do we want it to be when it grows up? And obviously we wanted it to be a nationally recognized leader in orthopedic and spine care, on par with the Hospital for Special Surgery in New York, Cleveland Clinic, Mayo Clinic. We were hoping that someday, we would be in the same breath as those, and whenever people were talking about great orthopedic care. We hope to be the one on the West. All of these centers that are nationally recognized are in the Midwest or on the East Coast, and we wanted to be the first in the West to be that caliber of institution. In addition, I was hoping, and I think we all were hoping, that we would have a place where people would think differently, in the sense that we wouldn't be bound by the traditions and the traditional silos that you will often see in a community hospital or even an academic medical center. Instead, what we wanted to do was to have an institution where we would have complete alignment between the doctors, the administration, the nurses, the pharmacists, the physical therapists, everyone, and so that we could avoid all of the traditional friction that occurs and instead really get down to the business of creating great care for our patients.
I think the goal was to be able to, number one, be able to have great patient care orthopedically, and to be able to bring doctors back in time to being directive in terms of how patient care is done. And when I say doctors, I mean healthcare professionals. I use that kind of in a generic term. So that, the vision was to be able to have a place where we could really take great care of our patients, have good value, and that was the start.
I think in a big bureaucratic institution like a major multi-specialty hospital, it becomes very hard to control your ability to isolate the quality of the care and the skill set that you need to provide premier care for patients, almost perfect care. And I think that was my main goal for coming over to HOI. I think that was important for us and for my patients as well.
Some of the clinicians that are involved with Hoag Orthopedic Institute truly are innovators. They've been all over the world to see the best of patient care in the area of orthopedics. And what this project allowed them to do was to bring kind of the best of the best from all over the world into one plan. And quite frankly, that's just inspiring. It's a wonderful opportunity for those that were involved in it. When you see all of those little innovations get strung together into a complete plan, that's what's really exciting, and that's the synergy and the magic of Hoag Orthopedic Institute. When you're only focused on one thing, it allows you to get tremendous expertise. It allows you to do things in a way that you probably would not otherwise have the capability or capacity to do. Hoag Orthopedic Institute already is garnering terrific notoriety in a very positive way. The outcomes are very encouraging, and in 5 years, I think its notoriety and its reputation for quality will be a conversation piece at the national level.
I think the one thing that makes me the most proud of HOI is the team, the culture. I think that originally we started out with this concept of hospital and physician alignment being the way to go in terms of driving healthcare in a forward direction. But I've been blown away by seeing how it's really the whole team that makes this happen. And what we've been able to accomplish in terms of quality, patient satisfaction, cost containment, all the things that are important in the emerging market. I just sit back sometimes and look at the whole team that surrounds me, and I'm just gobsmacked by how everybody's been able to pull together. That's our secret sauce. The secret sauce is the family that we've created here in terms of the whole healthcare delivery team.
The quality that has come out of this in such a short amount of time. We opened November 2010 after a very short amount of time to build the place to begin with. So we all kind of hit the ground running. But within a very short amount of time, the teams all came together and we started putting amazing processes together to really deliver the best care we could. And then I think we still see that today, even 3 years into HOI from when we opened the doors, there's still that drive for high quality and really excelling in the patient experience as well. And that's always been a part of the vision too, is to really create this center that has the patient and the family in the center of care. Obviously, that's what you need, but that doesn't always occur in healthcare. And I think that's something with HOI that we have been able to sustain throughout the first 3 years of opening, is this complete dedication to the patient and to what we deliver, which is the high quality orthopedic care.
So 3 years after opening and looking back at all that we've accomplished, I'm most proud that we have so many staff that have stayed for so long, that have given of their hearts, their souls, that have reached out to celebrate birthdays and anniversaries, to get cake for patients, to make flowers happen and appear, to give incredible care, and to reach 98th and 99th percentile on our HCAHPS scores almost consistently for 3 years. I am so proud and so humbled to be part of this team.
It's a team approach. Everyone participates, and there's not any one person that can accomplish this by themselves. It's got to be the whole team effort. So for that, I thank everyone, and I also thank you for letting me be part of it, because I enjoy it tremendously, and I think it's only going to get better, and it's probably going to be a lot bigger than any of us ever dreamed. So thank you very much.
So I'd like to thank everybody for just, this is a wonderful place to work, and it's a unique place. This is almost like working with family here. I think everybody's been just a great pleasure to work with. I've never worked in an institution with this kind of spiritual intensity of patient care and quality of care anywhere, including Cleveland Clinic and some of the institutions I trained at. So I'd like to thank you for that.
Thank you probably isn't enough. It's not close to enough. I've just been really so proud of everybody who worked here, everybody who's helped us take this to the next level in terms of the delivery of care that we're doing. I think the greatest thing is that everybody should feel such pride about what they've done. I've been absolutely thrilled to be able to give everybody the opportunity to feel the pride that I think they feel in terms of what we've all accomplished here together.
Well, I just want to say thank you for, the past 3 years and before. I mean, it was a year before we opened that we worked together so hard to build HOI and make it what it is today. And it's been an absolute honor to work with you. And it's something I'll always remember. I'm very proud of. And I just wish all the success moving forward. Thank you.
I'd like to thank all of the staff for putting up with me over the long hours, for tolerating me in my sick sense of humor, for my little tantrums sometimes, as well as for my jokes and pranks, and for the great humor and the incredible gift of their spirit, as well as clinical expertise, acumen, and for wanting to just come to work and have fun. I thank you for these wonderful years.
And I want to thank all of you. And I just want to close with a quote that's one that I really enjoy. And that is, never doubt that a small group of thoughtful and committed people can change the world. Indeed, it is the only thing that ever has. Thanks for all that you do for HOI.